Hi, Mr. Shinnick. My name's Todd. I'll be your nurse today.
Hi. Good to meet you.
So what I'd like to do first is just review your vital signs that you had done a few minutes ago. Your temperature looks good. Your blood pressure is 132/78.
Is that good?
I think that's pretty good for your age. When you were on a blood pressure medicine, correct?
Yes.
When did you take it?
This morning.
What time would that be?
Right around 7 o'clock.
Okay. Well, that's good. Your pulse was 76, which is good. Your pulse ox was actually 96, but you were at rest with your oxygen on. My understanding is if you don't have your oxygen on, it gets a little worse.
I get out of breath, I'll tell you that.
Okay.
I don't know what the thingamabob does, but...
Okay. And are you in any pain today?
Oh, no more than the usual, you know.
Okay.
Stiff joints and...
Could you rate it on a scale of 1 to 10?
3 or 4, I guess.
Okay. Do you take anything for that?
Yes.
What do you take?
I take naproxen twice a day.
Okay. Does that work well?
I don't know, I've been on it so long, it's hard to tell. I don't want to come off it, so I guess it probably works okay, but...
Okay. So what I'd like to do first is just kind of go over the medical problems that you had, and then we'll talk about anything new, and then I need to do a physical exam. Okay? So what is your understanding of your medical conditions? What are you diagnosed with?
Well, I think I got the emphysema.
Okay. And how long has that been going on?
Well, I think it's been going on a long time. You know, it's been getting worse here lately. I think I've probably had it for years.
How long have you been on oxygen?
Oh, a couple years.
Okay. Have you noticed any recent change in your breathing or shortness of breath or?
Well, it just seems like it just gets a little worse every so often. I mean, nothing's happened lately. It's just, you know, 6 months ago I could breathe better than I do now.
Okay. Have you had any coughing or coughing up anything or?
Well, yeah, I mean in the morning, you know, I cough quite a bit in the morning. Sometimes I cough up more stuff than others, but...
And all the time in the morning you cough things up or?
Not all the time. Not all the time. Maybe half the time.
Half the time. And when you do, what kind of color or consistency or?
Oh, you know, it's not like when you're sick, you know, you can tell when you're sick. It's just like clear, maybe a little yellowish.
Okay.
Not that green stuff.
Okay. Well, that's good. And if you did have a change in the color or consistency, what would you do?
Well, I guess I'd call my doctor.
That's the right answer. That's what I was wanting to hear, because that could be indicating that something bad's going on and we need to kind of take a look at you.
That, you know, when you're sick, you can tell.
Okay. Any other problems with your breathing have you noticed? Can you walk about the same distance or?
Same as what? Same as 6 months ago or same as yesterday?
Yeah. Same as 6 months ago?
No, probably not. Probably not the same as 6 months ago.
Okay.
Not as far.
And how about yesterday?
That was about the same as yesterday.
All right.
You know, it's hard to tell day to day, but you know, when I think back, like, you know, how was I doing last year, and I can tell I'm just declining.
Okay. And I know that you're on several medications, breathing medications. How are you doing with those?
Well, I have a lot of inhalers.
Mm-hmm.
You know, I try and keep track of them. I think I do okay. You know, if I get short of breath, there's a couple I use every day, and then there's the ones I use just in case I get really. But sometimes if I get a coughing spell, then I'll use one of those. But
okay, so the ones that you take regularly, like the Symbicort, you take them.
Yeah, Symbicort. Yeah, that's it. That's
okay.
I couldn't remember the name, but I think that's the one.
Are you pretty good at taking them every day?
Oh yeah. I'm very good with my inhalers.
All right. And do you use a spacer when you use them?
Yes, sir.
Okay. And how about washing out your mouth afterwards?
Not really. I mean, sometimes I guess, but
Okay.
I didn't know that was an issue.
Well, with the ones that have the steroids in them, they can sometimes cause mouth irritation or throat irritation.
I wash out the spacer.
How about your mouth though?
I'm not especially. I mean, you know, when I brush my teeth and I got mouthwash, but I don't do that specifically with the inhalers.
You might want to consider it. Have you ever noticed any soreness in your mouth or throat or?
Well, come to think of it, I guess I kind of have. I didn't know that was related to the inhalers because it kind of goes to your throat, but my mouth is just sort of, you know, sometimes it hurts when I chew.
Okay, well, we're going to take a look at that when we get into the exam. Have you ever needed more oxygen lately?
No, not lately.
Okay.
You know,
And how often are you using the rescue inhaler?
probably a few times a week.
Okay.
Not every day, but maybe every other. I mean, it kind of goes in spurts. I get like, you know, a few bad days. I use them a lot. Then I have a couple good days, but.
Is the bad days associated with anything in particular?
Oh, I don't think so. I don't think so.
Okay.
I should probably quit smoking.
You're still smoking?
I'm still smoking.
How much are you smoking?
Oh, you know, I find a way. I probably smoke. I don't smoke 2 packs a day anymore, but I don't know, maybe a pack.
And has that been pretty regular?
The smoking a pack a day? Yeah, it's pretty regular.
Okay. For how long has it been since you've been smoking a pack a day?
Oh, I probably cut down maybe about a year ago.
About a year ago?
They said I needed to stop, and I was planning on stopping. I just kind of went down to a pack. That's about all I could do.
You know, we have a lot of new stuff that we can use to help you stop smoking. Would you be interested in stopping smoking?
Oh, I don't know. I tried some stuff a while ago, so probably 10, 15 years ago. It didn't do nothing.
Well,
So I hope it works better than that.
you know, I'm really concerned about the smoking, and obviously with your breathing and the way that your lungs are functioning, we just can't afford to have any more damage to your lungs right now.
Yeah, I know, but you know, the other side of the coin is you gotta die from something, right?
Well, maybe it could be something else.
All right.
Okay, so what I'd like to do is I think we should talk to the doctor about that.
Okay.
And then I also think that maybe we should follow up with talking to a psychologist or therapist or something like that to see if we can try a double whammy of maybe the medication and some type of smoking cessation program at the same time.
A psychologist?
Or someone who
I got
is
no
pretty
time
good at
for a
that.
psychologist.
How about someone who's just really good at helping people stop smoking?
Okay.
All right. So we'll see if we can start that moving. All right. When you do smoke, do you wear your oxygen?
No, I don't do that.
Okay. How long do you take?
I know better than that.
All right. You know, honestly, I've known people that get a lot of oxygen in their beard. So you need to make sure that you get a little bit of time away from the oxygen before you start smoking.
There's oxygen that sticks around in my beard?
It kind of,
Wow.
you know, gets.
I would have thought of that.
Yeah. So
Well,
even after
I
you
take this off, I don't want to blow
Okay, but-
myself up or nothing.
make sure you give it a few minutes before you start smoking. But I would prefer if you don't ever smoke another cigarette.
I know. I've been hearing that for a long time.
Yeah. Well, you know, every time you try to stop smoking, you get better at it.
I don't know if I fall into that category, but if you say so.
Well, I think we should give it a try.
All right.
So I noticed that you've also had a little bit of problems with BPH with the prostate.
Yeah, I guess so.
Alright.
I guess so.
And how are you doing with that now? Are you having any hesitancy?
Well, yeah, you know, I don't make a stream like I used to, and I'm up probably about every 2 hours.
Okay. And are you taking the tamsulosin?
Yes.
Okay.
I'm taking all my meds as they're prescribed. I have me a box. and I get it all organized for the whole week.
Okay.
So,
And have you noticed any change in your stream or frequency?
oh, not lately. You know, it's not great.
Okay. I also, so we'll see if we can talk to the doctor about that a little bit too. Okay. I also see that you've had some problems with constipation in the past.
Yeah, I've been constipated before.
How about now?
No, I've been pretty regular lately.
Okay. How often do you have a bowel movement?
Oh, probably about, once a day, once every other day.
Okay. Any change in the consistency or color? Or...
No.
Okay. Those are some of the things that are in your chart from before. How about anything new? Have you had any new?
Just other than the breathing.
Mm-hmm.
Sometimes I wonder if those inhalers don't work on me no more, but no, nothing else really new.
Okay. Well, outside of the idea of that we need to get these cigarettes, to get you to stop smoking, I think we should also look at when the last time you had some pulmonary function tests to kind of just see, where you are with that. Okay. But that's something that we need to discuss with the doctor and kind of move forward from there. All right. How about joints? You said that you get a little achy sometimes. Any change in that?
Oh, I'm achy all the time.
Mm-hmm.
I mean, it's worse in the morning. I can tell when a storm's coming in, but even on a good day, it's, your whole body aches.
Right. Okay.
It's my back and my knees and my shoulders.
Anything new with that?
No, not really.
Okay. How about skin? Have any sores recently or
No, I don't think so.
rashes or anything like that?
No.
Okay. Just a good opportunity to talk about any other issues you're having.
Oh, I can't think of any.
Okay. So what I'd like to do now is let's just start doing a little bit of the physical assessment. A little bit more about the smoking. Do you have anyone who you see as very supportive that can help you with this?
Oh, I'm sure my wife would like me to stop smoking.
Mm-hmm. Does she smoke?
No, she doesn't smoke. She nags, though.
How long you been married?
The last year is always the hardest. We've been married 48 years.
Wow. So is she pretty supportive overall?
Yeah, I guess. She's good. She's a good woman. She's put up with me for this long, so gotta give her credit for that.
Oh, good. How about any other family supports or anyone else that you see that could be helpful?
For smoking?
Or how about stop smoking?
Yeah, stopping smoking, yeah. No, not really. I mean, they're scattered to the four winds. They're all around, but...
Okay. So what do you like to do to keep yourself active?
Well, I used to do a lot of woodworking,
Just check your ears here real quick.
but I haven't been doing much of that lately.
Uh-huh. Anything else?
I like cars.
A little hard to do that when you're not breathing too well.
I haven't worked on cars in forever, but I used to collect cars.
Oh, wow. I'm going to just check your eyes real quick.
Okay.
Okay. Take the glasses off. It might help. All right. Okay. All right. So I see that you do have a little bit of whiteness on your tongue.
Okay.
That might be from the thrush. Maybe from washing your mouth out. Not washing your mouth out with the inhalers.
Oh. Okay.
All right, so maybe if we start doing that, that'll help a little bit.
Okay.
All right. Any problems with your nose? Breathing okay?
Doing all right.
Okay, how about, are you using humidity with your oxygen?
I have a humidifier that I use at night for sure.
Okay, all right. Do you ever get any real dryness or anything like that?
Yeah, I mean, they're just kind of dry.
All right, how about, mind if I touch your nose here?
Go ahead.
That breathe okay?
Yeah.
Yeah, how about here? Okay. I just want to assess your cranial nerves and ears and stuff. Can you do this okay?
Yes.
How about over here?
Mm-hmm.
Okay, does that feel about the same?
Yes.
How about that?
Yeah.
Okay, that?
Sure.
Any change in taste or?
Well, you know, food just doesn't taste like it used to.
Mm-hmm.
You know, I like sweets now a lot. I have a sweet tooth.
Okay.
But other things just, you know, they're just, I don't eat as much as I used to either. I just don't have a taste for food.
Okay, but no real big changes in sensation?
No.
Okay. Can you smile for me? All right. Stick your tongue out. Left, right. Okay, no problem with that. You can put your glasses back on. How about strength? Any changes in strength?
I don't think so.
All right. Push. Pull. Okay. Can you lift your knee?
Ooh. It's a little painful there.
A little painful. Okay, how about this one?
Yep.
Okay. Just want to check your ankles here. You never notice any swelling or anything like that in your ankles?
No, I haven't had swelling in my ankles.
Okay. What I need to do is I would check your pulses, but you got the shoes on right now. Okay. I think what we might want to do is just try to do that when you're in with the doctor. But okay. You actually have a very good pulse here. How about your toes? Have you had any problems with your toes or feet?
No, they told me if I don't stop smoking that I'm gonna maybe lose a toe or something, but that hasn't happened yet.
All right.
No I mean, the backs of my legs kind of hurt like my calves when I walk sometimes. That's been going on for years.
Okay. How about right behind right back here at all?
Yeah, right about there, kind of upper calves. You know, if I walk too far, it'll do that.
Okay. Does that hurt very much when I do that?
No, it's okay.
Okay. All right. How about that?
That's okay.
All right. So I would like to get a chance to maybe listen to your lungs and heart real quick.
Sure.
Do you mind unbuttoning your shirt?
Okay.
You do it all the way down. As a smoker, I want to really get some good listens here.
Okay.
All right. So are you involved in anything spiritually? Do you go to church or?
Oh, I go to church sometimes. Yeah, I'm a Catholic.
Okay, take a deep breath for me. Again. 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 Okay, one more time. Again. Okay, you mind giving me a cough? Okay, I just want to listen down here again. All right, now we're going to do the front. Take a deep breath. Again. Again. One more time.
I think my heart's up here.
I'm just listening. Now, you told me that you had regular bowel movements.
Pretty regular, yeah.
Yeah. Any pain in your abdomen? All right. All right, I just want to listen to your heart. Just relax. Do you ever feel any fluttering or weird feelings in your chest?
No.
When you stand up, do you ever get dizzy?
Oh yeah. Most of the time.
Most of the time? How often does that happen? Like
Well,
every day or in the
yeah.
morning, afternoon?
Pretty much every day. I mean, I don't fall down, but I get a little dizzy every time I stand up.
Like things get a little black or things spin?
No, not spinning. I wouldn't say black, but just, like I could pass out if it got worse.
Okay. So one of the tricks with that is, I think that's something we need to talk to the doctor about. But when you stand up, I'd like it for you to maybe sit there for a second before you start moving.
Okay.
Yeah,
that's-
maybe hold on to something and
That's what I
give yourself a
do.
second.
If I just stand up and get going, that's not good for me. I stand up and I usually wait a second or so.
Okay. So how would you say your mood's been lately?
Oh, not too bad. Pretty
Yeah.
good. I've been all right.
How you sleeping?
Oh, well, I think I could sleep a lot better if I didn't have to get up and pee every 2 hours.
Mm-hmm. Do you have any problems getting to sleep?
Nope, I go to sleep pretty good.
All right. You feel rested when you wake up?
Well, I guess so. Yeah,
Okay.
I do better if I get a nap these days.
Yeah.
Yeah.
Do you use a lot of pillows when you sleep? Do you?
I use pillows. Yeah, I sleep on. What do you mean a lot? How many
Like,
is a lot?
I don't know. How many pillows do you use?
A couple.
Couple. And when you take a nap, are you in bed or do you sleep in a recliner?
Oh, I like my recliner.
Do you find that you sleep better sometimes in that?
Yeah, actually, I do. I do. The wife, she doesn't like me falling asleep in front of the TV on the recliner. Just, I don't know, it bothers her. But it works fine for me.
Okay. How's your appetite?
Well, it's okay. I think I told you I have a sweet tooth.
Mm-hmm.
But, for everything else, it's probably not what it used to be.
Okay. And have you had any feelings of depression or anxiety or anything like that?
Nope, I don't think so.
Okay. Ever had any thoughts of wanting to hurt yourself?
No.
Okay. All right. Do you feel like there's anything that I'm missing right now with this exam?
I don't think so.
Okay.
I don't think so.
So, just to kind of summarize things, I am worried about your breathing, obviously, and we need to talk to the doc about that, especially the fact that you're still smoking. And I think that we need to discuss things that we can do to maybe stop that.
Well,
Okay.
I've been smoking about 50 years, so it's just I don't know if I can just quit.
Well, I think that there's medication options, and I think that there's support groups and things like that that can help. It sounds to me like you've got some good social supports with your wife, who might be very encouraging.
Well, she would be happy if I quit. That's true.
Okay. I'm a little
Sometimes I think I smoke just to spite her, though. Don't tell her I said that.
No, I would never tell her that.
Okay.
I also understand, I'm a little bit concerned about how many times you're getting up to go to the bathroom at night. And I think we should also maybe explore this dizziness when you stand up type of thing.
They did a check on my prostate blood test. They did that about a year ago, and they said it was a little high, but they didn't seem too worried.
Okay. Well, I mean, you're on a medication. We might just need to adjust that, but they can also affect the blood pressure a little bit too, so we need to watch that. Okay. All right. How about, have you been to a dermatologist recently?
Well, I went to a dermatologist a few years ago, and they took a couple things out, but they said I had no cancer, so.
Okay.
That was good.
Did they recommend follow-up care?
I think what they told me is if I saw something new show up, that I should go back.
Okay. Have you had a full skin check since then?
Not since then, no.
Okay. So maybe when we get you down in a gown, we can make sure that there's no odd areas like that. Okay. Your feet, you said that we need to check those out also when we're in with the doc.
Okay.
Do you go to a pediatrist or have any issues
No, I don't
with
go
those?
to a podiatrist.
Okay. All right. And are you allergic to anything?
Not that I know of.
Okay. All right. Well, what I'm going to do is I'm going to set you up for the doctor to come in.
Okay.
All right?
Very good.
All right.
Thank you very much.
Thank you.